My name is Maria Wazifadus. I came by birth to Australia. I've been living in Australia under temporary visa, chef visa, for more than 7 years now. I have been very fortunate to graduate from Bachelor of Nursing. It's now more than a year that I've been working as a registered nurse in Australia. As a nurse, I understand it is a critical moment for us to work together to slow the spread of COVID-19 outbreak. This pandemic has affected the lives of many Australians, but also the lives of so many vulnerable groups, including refugees and asylum seekers. I consider myself privileged to have the opportunity to contribute by working as a nurse day and night to ensure that our people are safe and protected from COVID-19. Lastly, we must keep our humanity alive and show solidarity with the refugees and asylum seekers during this time of widespread uncertainty. I hope that access to Medicare and health services become more available to all asylum seekers.
My name is Shahnaz, a refugee from Afghanistan. I'm currently working at least 6 days a week as a registered nurse and believe I have a lot to contribute to helping with COVID-19 pandemic with no cure and no immunization at the moment. Community awareness is key to tackling this pandemic. I urge the international government to reach populations that are most vulnerable, including displaced and refugees, to the spread of COVID-19. Let's focus together to fight this virus.
My name is Zara. I came to Australia 19 years ago as a refugee. And currently I'm working as a frontline worker as a nurse. And in this critical time of COVID-19, my priority is to work day and night to be able to help all people in my role, regardless of whether they're a citizen, an asylum seeker, or a refugee, because we're all in this together. Now, the health system and its responsibility is to include all the vulnerables like refugees and asylum seekers to COVID-19. Otherwise, the risk will still remain high. COVID-19 does not discriminate whether you are a refugee or not. And I urge all governments to include refugees and asylum seekers in their national health response to COVID-19 and provide Medicare access to asylum seekers. Thank you.
Hi, my name is Foroza Nazari. I used to work as an AI nurse back in Pakistan before I get my humanitarian approval for resettlement as a refugee. Now I work as an AI nurse in aged care to help the most vulnerable group in the community, elderly. COVID-19 does not discriminate and does not care about nationality, ethnicity, or other differences between people, and will infect all, including refugees, displaced, and asylum seekers. Many refugees and asylum seekers around the world is working as a part of healthcare, as the way I do, to ensure the vulnerable group like our elderly are looked after. It's about time to resettlement countries to allow the asylum seekers nurses to fill in the health gap, as the health workers remains to be the target in COVID-19. We are all in this together, and time to strengthen unity and solidarity.